Hello, I'm Dr. Manish Joshi. I'm the Chief Surgical Gastroenterologist and I head the Department of Surgical Gastroenterology, Minimal Invasive Surgery, and Bariatric Surgery at BGS Global Hospitals in Bangalore. GI surgery was not heard of for the before 2 decades ago, but since the last 2 decades, it is one of the most exciting and most challenging fields for a general surgeon. I would say that where the general surgeon stops, the GI surgeon starts. And for a general surgeon in a surgical practice, if he encounters a challenging case, he has a GI surgeon to back on as a backup plan in case he runs into trouble. But for a GI surgeon, probably the buck stops there. A general surgeon would be able to manage all variety of cases, but when there are complications or when there are complex situations, especially in the field of liver, pancreas, esophagus, and cancers, it is much better that a GI surgeon deals with these kind of cases because he is much more skilled and much more trained in dealing specifically these complex and challenging cases. Um, each one of us has complications, but a GI surgeon would probably be able to manage the complications much better and give the better results for the patient. And GI surgery as a field in India is still evolving, and there are only few centers of excellence and few centers of training available. But hardly I would say that the number is adequate for the kind of requirement that is for a large population in India. But we are reaching there. New and new centers are coming up with GI surgical training program. As compared to the West, India is still much better placed because we are into different fields and different training. And GI surgery itself has evolved into subspecialization. In the West, they are already going into upper GI services, colorectal services, and HPB or liver and pancreas services. In India, it is soon to happen. And in India, the GI surgeon is also evolving into a bariatric or a weight loss surgeon or a liver transplant surgeon. So more and more specialization or subspecialization is going to occur in the future. But I think it is exciting times to be a GI surgeon in India. Academic wise, the centers of training for a GI surgeon are limited to a few places which are premier institutes in the north, and few centers and few states like Tamil Nadu, which has taken up GI surgery in the forefront in terms of education and training. People from there have come out and now established centers in various other states in India, and slowly it is evolving, and more centers of excellence and training are shaping up. So in 5 or 10 years from now, I think there will be more and more states having departments of GI surgery and training centers for GI surgeons in the future. Healthcare is a place where there are 2 or 3 things that we need to look at. One is what best we can offer to the patient, and at what cost we can offer to the patient. In an Indian scenario, it is very much relevant, and government has tried to minimize the costs, especially in the government sector, in the public hospitals, as well as by controlling the prices, which is a good step, I would say, for the larger population, which is a rural population in India. And there is a mix of corporate hospitals or the private hospital setups interspersed as nursing homes, secondary care hospitals, quaternary care hospitals like BGS Global is. So this caters to the complex and challenging cases as well as to the private patients, where quality of care is given more importance. The role of technology is the one thing which has changed the way GI surgeons are looked at. And as surgery is evolving, earlier it was the technique of surgery which had changed, but nowadays we don't see much change in the technique of surgery. All we see is the technology which is changing. Earlier, like we say, we have 2G, 3G, and 4G. We can take the same example for surgical practice as well. Earlier, we used to do open surgery, then came minimal invasive or laparoscopic surgery. Now we are doing single incision surgeries. In future, it might be endoscopic surgery or it might be robotic surgery, which is where the world is inclined towards right now. So technology has made a major impact and revolutionized the way surgeons are practicing all over India and all over the world. If you are not able to cater to the needs and provide up-to-date quality care to the patient will go to somebody who will offer the best option available. So it is probably patient-centric also, and result-oriented also. There's some amount of industry-driven effort as well to make sure that the gadgets which they come up with are utilized. But probably it helps increase the quality of care for the patient, but there's a small drawback that increases the cost as well. And that's an interesting question. In surgical training, when we undergo the initial surgical training, it's all mainly open surgery. And once we have learned or mastered the open surgery, we move into laparoscopic surgery, which is minimal invasive or keyhole surgery. From there, we increase our skills and go into endoscopic surgery or robotic surgery. But if any of the technology fails, or at many of the occasions where the situation is complex or the tumor is complex, we fall back on the traditional method of open surgery, which is still a gold standard in most cases, and which is still the initial basis of surgical training all across the globe. The doctor-patient relationship is changed a bit. Initially, we were just had one open surgery and surgery was offered. Now we have various options. We have laparoscopic surgery, we have endoscopic surgery based on the expertise available in the hospital, and the types of gadgets available also. We can offer them a different range, including the staplers, including the meshes that we use. We have various sizes and various different we have various sizes, and we have different synthetic materials that they are made up of, which if the patient is affordable, they can choose the best quality mesh or the lightweight mesh, or the ones which are going to cause less trauma to the tissue. But we also have similar standard meshes which are available even in the public hospitals, where we can use it for the non-affordable patients. So there's a wide range, and sometimes it is difficult for the patient to choose between, if we give them 2 or 3 options. So that probably is a way where we have to counsel them and educate the patient as to what is the pros and cons of each option or each strategy or each kind of surgery that is available right now. Global Hospitals, I would say, is quite a different corporate hospital, which has focused on not only upgrading their infrastructure to what is latest available in technology, but also having quality of service and quality of patient care in mind. In terms of the patient, they provide the best quality of surgeons or the doctors available, and their focus is on high-end work. So all the complex situations which nobody else would be able to handle comes and gets referred to Global Hospitals. We deal with bone marrow transplant, we deal with kidney transplant, we deal with liver transplant, we deal with bariatric surgery. We are a center of excellence for pancreatic disorders. We have the latest spyglass model which is available, which very few centers have. We have the endoscopic ultrasound, which is a gadget which is very beneficial in pancreatic cases, which we use for all pancreatic disorders. These things not only create a center of excellence, but probably give an extra edge than the usual multi-speciality hospital in providing quality care to the patient. At Global Hospitals, we are a center of excellence for advanced laparoscopic surgery. Not only we do the routine surgeries with laparoscopic approach, we also do advanced cases like esophagus, pancreatic surgeries, liver surgeries, rectal cancer cases. All are done laparoscopically, which helps the patient recover faster and shortens their hospital stay. So in terms of cost effectiveness, laparoscopic surgery has been proven to be more cost effective than open surgery, and we provide that to each and every patient of ours. And as a center of excellence, the infrastructure and the technology matches the rest of the world, and we are proud to say that we are a center for advanced laparoscopic, not only for the patient, but we also train the younger surgeons in laparoscopic surgery and in GI surgery. We run a fellowship course which is widely acclaimed, and we impart the current technology as well as the current skills to the younger generation of surgeons. The future is actually very exciting. I'm happy to be in a stage where there is a transition between open surgery and laparoscopic surgery, and we could get best out of the skill sets. and soon the world is moving towards robotic surgery. So it is going to be more and more technology driven. The earlier I adapt, the earlier a surgeon adapts, the earlier a doctor adapts to newer technology, which is beneficial for the patient, the much longer he will be able to serve the patient population. As a physician, probably the number of years of experience is important. As a surgeon, probably it's how earlier you adapt to the technology and provide the current best option to the patient is what matters. So I would say put in all the effort. There's a saying by Jim Rohn, if I can put it across. Uh, Formal education can help us make a living, but self-education will help us make us a fortune. So invest in yourself, upgrade your skills, learn the new things which are being already proven in the market, and make sure you offer that to the patient, and then you will be able to serve them for a longer period of your career. Thank you very much.